I'm Dr. Alex Roher with SD Botox, and today's discussion is, can Botox be used to treat hooded eyes? And so hooded eyes, when there's excess skin above the eyes, either the eyelid or the tissue right above the eyelid, and as we age, like everything, it sags, and your eyes look smaller, you look tired, etc. So Botox is a class of drugs called neuromodulators, and it's injected into certain muscles to partially paralyze them. And one area that we often inject, it's called the orbicularis oris, or commonly it's used to treat the crow's feet, so the lines that come out of the eyes. I got some right there. And one advantage to injecting that muscle is that you're treating the wrinkle, so the muscle's contraction is what causes the wrinkle, but two, you're treating the muscle that pulls down the tail of the eyebrow. So you can see when I make that face, I'm pulling down the tail of my eyebrow. And so by selectively paralyzing the upper outer part of that muscle right here, right below the tail of the eyebrow, you're selectively paralyzing the depressor. And so the elevator, the frontalis, the forehead muscle, is now unopposed. So meaning there was usually one muscle pulling down and one muscle pulling up. We selectively paralyze the muscle that pulls down, so the muscle that pulls up is unopposed, and so it lifts the tail of the eyebrow, and so it opens the eyes, and you look more rested, and you have less hooding of the eyebrow as a result.